Everybody, it's Dr. Eric Balcavage. We're back for another edition of the Thyroid Answers Podcast. And we have a great guest today. Her name is Jenn Pike. She's a medical exercise specialist and a functionally integrative diagnostic nutritionist, and she specializes in health and women's hormones. And I brought her on here today. I did an episode of her podcast, and we had an awesome discussion. We met back at a conference, maybe back in September, and kind of hit it off with a friend of ours, Dr. Carrie Jones, who's also a wonderful person and super smart lady as well. But we wanted to have a conversation today because she really focuses on hormones and has some programs that really help guide women through what I call the perimenopausal paradox. Like when you're going through this change from having ovaries that are making tons of estrogen into menopause, there is a lot of change in physiology. There can be a lot of change in symptoms, and a lot of women struggle. But there's also this noise around this transition where we're treating a lot of women as if they have a disorder or disease, and it creates confusion many times because if it's a natural process, why do we have to treat everybody as if they have a disease or disorder? So because this is really the crux of what Jenn focuses a lot of time on, we brought her on here to have this discussion. And I think it's going to be a really good one for the next 90 minutes. So Jenn, welcome to the Thyroid Answers Podcast. How are you today?
I'm good. Thanks so much for having me. I'm very excited for this conversation.
So usually I start with like, how did you get into the process? But you know what? I think we've got so much to talk today. You've written 3 books. I think the whole idea that you're an expert in this area, people will get that as we go through. And I want to make sure we try and get as much packed into this as possible.
Yeah.
It's not that I don't care about your background, but
it's okay. It's rather boring to repeat it again and again. So
every story starts the same with everybody. Like, I had a health problem. I got involved.
See, that's not my story. So there might be the interesting thing.
So maybe we should ask. Okay. So how did you get into this?
So my background, it was in fitness. When I went to school to become a medical exercise specialist, I had an opportunity pretty early out of the gates. I was personal training. I was a director for Sports Clubs of Canada and Bally Total Fitness, and also working part-time at a gym where I grew up in Ontario. And I got an opportunity to work with a lot of professional athletes, mainly those who are in the NHL, which PS Canada kicked US's butt last night in the Four Nations. And I'll just cheer that for a moment in the hockey. But so I was working with athletes, and I loved it because it was such a fun environment of being able to just witness the potential of the human body. And when you take individuals who have that kind of drive and motivation, they're the best of the best and they're being paid to be the best of the best. It was really fun. They would do anything you asked them to. But what I noticed early on was they had the community. They had a village of practitioners and nutritionists and chiropractors, and like, you name it, they had it. And then I was going back into the gym and I was training the everyday woman. And I very quickly was realizing, the vast differences of, these women who I consider to be the everyday athletes of life, right? Like, they're a team of 1, but doing what a team of 5 would be doing in terms of raising their families, building a career, trying to maintain a healthy relationship, finances, whatever it may be. And I was really witnessing the struggles they were having. And for me, when I was growing up, how I even got into fitness was, my mom would go to jazzercise with her girlfriends or go for walks in the neighborhood. My dad would head to the gym, and my dad started to take me with him to the gym, and I was just like blown away at witnessing this. So I didn't have, health issues and that. I got into an environment from a young age where I was like, this looks really cool. And then I started to be part of the movement, and I loved how it made me feel. And I wanted to help others feel that way as well. And so when I was working with these women, what I started to recognize was that the exercise was only going to get them so far. It was amazing, but it was only going to get them so far. And they were asking me a lot deeper questions about nutrition just beyond a meal plan. So I went back to school in 2001, and I initially became a holistic nutritionist. And that opened up my mind to just a whole new way of looking at food that, when I was going to school to become an exercise specialist, we were trained based on like Canada's food guide, which was is not healthy. And so as I dove deeper into that, then what I realized was, okay, the nutrition and the exercise is getting these women to a point, but they're all coming to me saying, I am exhausted. My hair is thinning and falling out. The weight is not budging and I'm not changing anything. I'm sticking to the program you created and I don't know what's going on. I'm just gaining weight. And, I've gone to my doctor. I've asked for thyroid labs. I've asked for blood work done and I'm being told I'm fine. I don't feel fine. And this really got me thinking like, well, then what the heck's going on? Because I could see them gaining the weight. I could see them trying to do all the things. So then I again went back to school, started to understand more about functional blood chemistry. And I just kept like chipping away at every time a woman would come to me and, have this struggle where she felt like she was being dismissed and she couldn't get the answers. I was like, I'm going to go and see if I can try and discover something as to why potentially this is happening. And so that's how I got into this industry. And when I became a mother, when I had my first child, at 26, that like blew my mind because everything I thought I knew, and I'd been hearing these women who were mothers say to me, just you wait, or this is going to happen. And I was like, whatever, I do this for a living. And then I had a child and I was like, whoa, things are now different. And then I had another child. And then I, owned a brick and mortar business. And then my business was building, all these different things happening. So my connection to wanting to work with women in this way is that we've been fed a story that is your body is broken. There's something wrong. We've never been taught what we should have been known about our bodies from a very young age, from like even before we were going to get our first period, all the way through the decades of transition. And then you get women who come into their 40s and their 50s and they're in the perimenopause paradox, as you said, transitioning into menopause. When life is just squeezing them from every direction, they're back in this energy of the body feels like it's failing them and they feel like they're doing everything and frustration is just mounting and mounting and mounting. And I've witnessed what happens when they move purely into an allopathic approach. And, those women actually who are going to their family doctor, OBGs, what I've seen, it's not that they're necessarily being recommended HRT out of the gates. They're being given the birth control pill in their 40s. They're being given an antidepressant. They're being put on an anti-anxiety medication. And so that's how I got into doing this. And, I'm hungrier today than I've ever been because we have access to more information than we have ever had before. And women are more confused now than ever.
Okay. I was going to jump in with a question like, why do you think that is? But that's down the line a little bit for me. I want to start a little bit more basic and I'm sure a lot of women have a general idea of what's happening in perimenopause, but you give a little bit more detail as to what's happening. Because sometimes I make assumptions that women totally understand what's going on here. And when you really talk to them, they're like, I don't know. It makes sense. If I'm losing my ovaries, I wouldn't have estrogen, right? So let's talk about what's going on hormonally with estrogen and progesterone and testosterone, like early on, like when they're having a cycle. What's going on when we have optimal physiology? What's going on as we're going through perimenopause, the downregulation? Where are hormones primarily being made, and what's happening? How should a healthy person regulate hormones in menopause? Can you do that?
Yeah, no problem. Okay, here we go. All six of those in one. So we'll start at the beginning, which is, you said something that there's this assumption that women just know. I will tell you most women don't know because again, they didn't even know what was going to happen when they got their period, let alone when their period was starting to leave the building. And so there's like ground zero of what we're talking about. Women have actually been taught to be very disconnected from their body and what's going on. So for most women, up until about 2 years ago, if you would have asked a woman, what is first of all, perimenopause wasn't even part of the conversation. It was just menopause. And women would have told you by definition, I'm just not going to have my period anymore. I'm going to have some hot flashes. I'm apparently going to have memory issues. I won't sleep. I'm going to gain weight. That's menopause. That is what most women thought was, the journey. And that's not actually what happens, because menopause is quite literally like a day on the calendar when we've gone 12 months where we no longer have our bleed. And now we're in what most people refer to as being like a postmenopausal state. And I'll break that down a little bit deeper in a moment. But perimenopause, or sometimes referred to as like premenopause, this is an oftentimes, 8 to 12-year journey in a woman's body where there starts to be this small, slow decline within the ovarian function in terms of the amount of estradiol, which is E2, that is being produced in the ovaries. And it goes upstream. So it doesn't just start in the ovaries. The brain plays a huge role in this. So the pituitary gland, where we are producing FSH, which is our follicular stimulating hormone, we produce our luteinizing hormone. These are big communicators that are literally have a microphone that is moving down that axis all the way to the ovaries and getting those follicles on the ovaries to start to ripen, to mature, to then release an egg, which is ovulation, which is the way that when we're in our fertility years, we produce the most abundant source of progesterone through the process of ovulation. Everyone's been taught that your period is the main event. Ovulation is actually the main event. Your period is the byproduct of when you've released that egg, you have not gotten pregnant. Those hormones now decline, which signals to the lining of the uterus, the endometrial lining, to now shed. And then the cycle starts again. So what's starting to happen, and depending on who you talk to and what literature you look at, somewhere between the age of like 35 and 38 is typically when there will start to be this ovarian decline that starts to happen. And so it's not that they just stop working overnight. That being said, if someone goes through significant trauma, there's major stress in life, even viruses and certain illnesses can very abruptly cause something that is called premature ovarian insufficiency, POI. And it can very quickly disrupt the whole mechanism and axis, because your brain and your nervous system are involved in the communication to your ovaries. So much like when we talk about, the adrenal and thyroid connection, well, when we're talking about a woman's cycle, we have the HPA-O axis. So we've got the hypothalamic, pituitary, adrenal, ovarian connection. And it's a very sensitive system. It can up and down regulate depending on the stress you have going on in your life, how well fed your body is. So I've seen a lot of women who embraced over fasting and too much caloric deficit, too much exercise, too much intensity, speed up their process into perimenopause and menopause simply because the body wasn't nourished enough. So what a woman might notice in the beginning is her cycle may not actually be the thing that starts to change first in those early days. She may notice that her sleep is not what it used to be. Her patience is not what it used to be. And, I always joke, but every woman can relate to this, that all of a sudden you recognize yourself being irritated by like your partner breathing and chewing. And you're just like, I want to throat punch you because you're like, oh, that's not normally me. Why am I being so agitated? Anxiety and heart palpitations, noticing hair changes and falling out, body composition, starting to do some things where you're like, this is not the norm for me. Oftentimes women will gain weight in their teens, 20s, and 30s in through the hips, glutes, and thighs. Now they get into their late 30s and their 40s and they're like, hold on, I'm gaining weight around my waist and my bra strap and my upper arms, and I've never dealt with weight in that area before. And then when it comes to seeing some of the cyclical changes, often, and every woman's experience is going to be very different, but often what will happen is that, let's say you had a 29 or a 30-day cycle, and that's been your body's rhythm for as long as you can remember. And now all of a sudden you have a 27-day cycle, and you're like, oh, that's weird. Period came 2-3 days early. And then it does that again the next month, then it goes back to normal. And you have like a 25-day cycle. So what starts to happen is the luteal phase, which is the period of time between ovulation and when you have your next bleed, it starts to shorten. And one of the reasons that starts to shorten and now you're getting a period sooner is we have that decline of progesterone. So when you asked, where are we producing the abundance of these hormones? Yes, directly in the actual ovaries, but there's also other areas of the body that are involved in that hormone production. The adrenals are producing some of this. The gut and the liver play a big role in this as well. And so those are typically the ways women will start to notice changes happening. Now, for other women, a big sign and indicator will be that they start to spot a few days before their period, and that wasn't normal for them before. They get mid-cycle spotting. Some women will say, I feel like I'm having 2 periods a month, or you never had a heavy cycle a day in your life, and now all of a sudden you are having these very heavy bleeds, where some women will say, like, it feels hemorrhagic. I feel like my whole period comes in 48 hours. I'm bleeding through everything. I don't even feel like I can go to work or leave the house. And then bam, it's gone. And then you have the opposite side of that, which is the woman who's like, I've been bleeding for 9 days. I have been bleeding for 3 weeks. I can't stop bleeding. And so I know it would be lovely if we could pack it all into a tidy little box and be like, here's the definition and here's what it looks like. Every woman's body is going to express it in a different way. But in a nutshell, that's what's happening from a sex hormone perspective. Now, that was just talking about specifically estrogen and progesterone. But if we're going to go deeper, there is an entire systemic change that is happening with our hormones in that time.
Yeah. So I want to just question this because I agree. A lot of women, it's going to be different from woman to woman to woman, how they experience it. And this may be a difficult question to ask, right? And you may be like, well, there is no normal. But there are women that fly through the process and say, hey, I went through the transition. It was really easy. I didn't have a lot of negative symptoms. So what's the difference where we talk about, okay, every person's different, therefore we need to treat. If a woman is truly in a very healthy state, mm-hmm. are they less likely to have all these negative experiences and negative symptoms as they go through the process? Or do you think every woman is likely to go through all these challenges because it's just part of the natural process? From my perspective, I've worked with a lot of women who've said, I didn't really have any problems and cruise right through it. But when I look at their health history, their lab work, their inflammatory markers, their thyroid physiology, blood sugar regulation, the reason that they may not have had much of an experience with negative symptomatology through the process is because they actually were really pretty healthy. But the women who already have health issues to begin with, those are the women who I see have the biggest challenges. So do you think that if somebody is truly healthy, and we can argue about what that definition is, but the healthier they are, the likelihood that they're going to have a lot of negative symptomatology around the transition from cycling to non-cycling is less likely if the healthier they are?
I mean, 100%. If you have very strong, intact metabolic health, which encompasses everything you just talked about, you are going to be less vulnerable and less likely to have most of those symptoms. And maybe you still get some symptoms, but they're not to an intensity and they're not at a duration where they're impacting your life in the same way that a woman would be like, oh my God, I feel like I hit a certain age and I just kind of fell off a cliff. Now, the thing that I will say on this, though, is that someone's description or perception that they cruised through it is also, we need to kind of unpack, because for some women, and because this is what I do, is talk to women all the time about their experience. On the surface, they'll say like, I didn't really have any side effects, or I didn't really go through any of those symptoms. When they're saying that, what I have found is the symptoms they didn't have were the common ones, the hot flashes, the night sweats, the weight gain, the brain fog, and that. But as you start to go deeper and you talk to them about things like, when did big digestion changes happen for you? When did like bowel motility change? When did the thyroid start to shift? When, maybe it's sleep, maybe they've got like super dry skin. Maybe they've got like, they had tinnitus, they got frozen shoulder, plantar fasciitis. So things that they would not connect to or attribute to menopause. Maybe they've been suffering from, all of a sudden they're like, I get UTIs all the time, but that was it. That has nothing to do with menopause. No, it is connected to the decline of the hormones. So The answer is a yes and 100%. The healthier as women we can be moving into any transition in our life, the better our body's going to be because we don't have these vulnerabilities of cytokines and prostaglandins and TNF and interleukin 6 and all of this that's like if you take a body that's already jacked up, right? It's like it's the rain barrel effect. If you're already almost full and now you have these changes happening hormonally, you're going to hit maximum tension and become symptomatic much faster than the woman who was starting at a really even keel homeostatic place in her body.
And I think that's where I'm trying to get at, right? This is the issue at foundationally for me, which is we're saying this is a natural process. And it's my belief that if this is a natural process in the body and the chemistry is innately decreasing hormone production, and our physiology is working optimally, then the likelihood that we're going to have a lot of those signs and symptoms is less, right? We shouldn't, because the body's should be adaptive to this. We've been on this planet for thousands of years, and our bodies have started to figure this out. I think the issue with symptomatology as we go through the change, not me, obviously, but as women go through the change, is that despite what many people think that, hey, I'm really healthy, and we can argue what that means and how we define that. But I think what makes this process more difficult is what we really talked about. The person's state heading into perimenopause determines the outcome of what it's going to be, which is why some women have less issues and challenges and some women have more. There are these changes in the chemistry, the changes in hormone fluctuation. When those things change and you already have an excessive stress state and inflammatory processes and downregulation of T4 to T3 and glucose resistance, and then you lose your estrogen and progesterone, the progesterone maybe also having an anti-inflammatory effect, the estrogen helping to support mitochondrial function, even in the face of reduced glucose conversion into energy, and even in the face of decreased T4 to T3 conversion, even in the face of inflammatory mechanisms. But if you already have those things going on and then the hormones go away, absolutely, you're probably going to experience more significant challenges. But I think, to me, and I want to get your viewpoint on this, and you may say, you're a dude, you're totally wrong in what you're thinking, and that's fine. But I think it's more empowering to women to know, like, going through this change is not a dysfunction. It's not a disease. It's a natural process by the body. So you don't have to be afraid of that piece of it. If you're struggling as you go through the process, it's because there's some mechanism that's not allowing you to regulate these hormones, the drop in hormones appropriately. And that's what we need to address. If we address that, you're fixable. If we don't ever address it, then you will need the hormones to support what your body can't make appropriately for this stage and age of your life. Does that make sense?
It makes sense, but I am going to challenge you on it.
Sure.
And the reason is that that would all be wonderful, but what we're not thinking about necessarily is that if you so even you could have the woman who is, she looks metabolically sound, but she is a warrior at managing stress, okay, up to this point in her life. So she actually has a higher stress bucket, and you don't see any of the signs showing up in her blood work or any testing. But now, as she's starting to have the decline of these hormones, that low DHEA from her adrenals and that low cortisol production and how she utilizes it was being buffered by having these ovarian hormones on board. And now, as they decline, this otherwise healthy woman she's kind of feeling like, I was standing, the table had four legs. Now I feel like I'm standing on a big toe. Like all of a sudden, I just feel like I've lost that stability. The other thing is that when we're talking to women about their experiences, I'm always looking at women through the decades. So if I talk to women in their 60s who say to me, I actually moved through it with ease. The life that we were living 20 years ago, for the women who were going through the generation of perimenopause and menopause then, is not the life we are living now. Even if we were to just hyper focus in on the chemicals that like the chemical soup that we live in as human beings now, and that women are the target market. If we go back 10 years ago, 20 years ago, there was not nearly the same amount of phthalates and endocrine disruptors and xenoestrogens and plastics and dioxins and everything from tampons and pads to makeup to hair care to body care to household cleaning to perfumes to deodorant to, like, you name it. Women are the target market, and their bodies are burdened in a way they don't understand because it's been marketed that this is the products that you use. So our system, our liver, our gallbladder, our elimination and detox pathways, they're being taxed in a way that a lot of us don't understand. And so for the woman 20 years ago who was not exposed to all of that, her body, through this natural physiological state of peri and menopause, could have moved through in a much easier way because she didn't have the additional burden of all of that. So I think the one part of the conversation I wish was being discussed more is the environment that a woman lives in and has been living in for the last X amount of years is going to have an impact on how her body manages this.
Yeah. And I think you made my point for me, right? And that is that in reality, if we had somebody who's in an optimal state of health,
Mm-hmm.
they don't have an excessive load, or they may have a manageable load, but the drop in hormones wouldn't make a difference because it's a manageable load. The
But how
challenge
many
is,
women do you know? Let me ask this. How many women do you know who live in that environment where they're not exposed to?
I'm not saying I agree with you that the issue is, I guess the point I'm trying to make is that women aren't broken because they go through this phase.
No,
this is not a broken
that
thing.
I agree with you
This
on.
is
That I
the,
agree with you on. It is not menopause and perimenopause that is doing the thing. It is that we go through this process stacked on top of a body that is dealing with all of these other metabolic and systemic health issues.
that's the point. That's where we agree. So I knew we agreed underneath it all, but I
I
think
can
what
stay on the
happens
show
is
now. Yeah.
we deal with so many. We have such a load of stress on our plate, and it pushed so many people into an overload system, and it changes our physiology. But it becomes so normal to live and operate in that state that we don't know that we're not in a healthy
100%.
homeostatic state. So
Yep.
that's the real issue, is that if we were in homeostasis, right, this low stress state where we can manage everything, yeah, these transitions and changes should be relatively easy. I'm not going to say super easy, but relatively easy. But the problem is, because of the load, this is just one more stressor on the physiology that it cannot manage, and it really creates an issue. And so this beautifully kind of takes us into the next question, which we've kind of already talked about, is, does hormone physiology change when we're in a low stress state versus when we're in a higher or an excessive stress state?
Well, yes, completely, because those mechanisms are listen, there are going to be the things that are naturally going to happen in our bodies, and then there are going to be the triggers and the things that are going to shift the mechanism, the intensity, the duration, and the lived experience of it based on what it is that's happening in your life. So, when we talk about things like allostatic load, we talk about chronic low-grade inflammation. It's interesting. My mom is going to be 80 in May, and I have these conversations with her. And, my mom ended up having a complete hysterectomy in her late 30s because of endometriosis. So she was put into medically induced menopause. But now, in hindsight, she looks like 40 years later, and she says, and what's interesting is then within 5 years of having that complete hysterectomy, that's when her thyroid went into the crapper. That's when her blood sugar started to become an issue. So it was this like compounding effect of not the one thing, but just the many things. And so I've like interviewed my mom on this before to go back in history. And she says to me, Jen, if I look back, now that I understand things about what low blood sugar symptoms are and, X, Y, and Z, I was having those for years before my body got to the point where surgery was recommended.
Yeah. And it's slow,
Mhm.
gradual, and continual. And we
Yeah.
wind up shifting the physiology to, oh crap. But it's because it's slow and gradual, and we don't necessarily, maybe I had a symptom today, but yeah, smile, right? Didn't really pay
Yeah.
much attention to it.
No
And
biggie.
and it just builds and builds and builds, and we don't realize it. It's like when your kids are growing, you look at them every day, they're not even growing,
Yeah.
right? And then somebody comes in who hasn't seen them in a month, they're like, holy cow, they're growing so fast. And you're like,
Yeah.
I just saw them. They're not really growing. Like
Yeah.
if you're the person who's buying them clothes, yes, you know that they're growing, right?
Yes.
But it's such a slow incremental thing. But I think it's so important for women to understand that going through this change in life is I think we're potentially with the paradox we're saying one hand we're saying this is a natural process. On the other side, we're saying, but every woman needs hormone replacement therapy.
Yeah.
Okay. And if you're the woman and I'm not, how do you write that in your mind? Like, if this is natural, why do I feel crappy? If this
Hmm.
is natural, why are we putting more hormone into my system if the system is down regulating it? So that's where I want to try and help women from a confusion standpoint. It's not that hormone replacement therapy can't make you feel better. That's
Yeah.
not my argument. It's not that it may not be appropriate for you given your situation or what you choose for a healthcare strategy. If you just want, hey, I got so much going on, I just need some hormone to kind of manage my signs and symptoms, then that's exactly what you want is a management strategy, in my opinion. And that's where those hormones can really be helpful. But if you're saying, listen, I want to know why I'm not don't feel well and how can I address this naturally, we should still give them the option that, yeah, given a higher state of health, your adrenal glands should help produce sufficient levels of hormone if you're optimally healthy to then support estrogen physiology in this phase of life. Um, and you, in the process of trying to help you fix it, it might be appropriate to manage some of your symptoms with some hormone replacement therapy while we figure those things out and address them.
Hmm.
But there is a possibility that you may not need like continual hormone replacement therapy if you don't want it and you want to address the things that are causing the physiology to be disrupted or
Yeah.
less than optimal. Does that make sense to you?
It totally makes sense. And for me, I mean, everything is rooted in the lifestyle. So I teach a course called the Perimenopause Project that is for everyday women and that practitioners come into as well. And the root of this education is that again, we just constantly do this as a society where it's like, okay, now we have, HRT is now safe again. Everyone's debunked the, Women's Health Initiative. So, it's the Oprah effect. Everybody gets a car, everybody gets HRT. And it's incredible how much education is happening around it. It's incredible that there's more accessibility that's there. And we don't just like paint with a broad stroking brush. If you're a woman and you're in this age, everybody needs to go on it. Now, do I think that HRT is incredible for a lot of women? I really do. I have seen firsthand the difference in a lot of women that I've worked with who were doing all of the things right, who were taking care of digestion, sleep, everything. And there was just something that, was out of alignment where we just couldn't quite snap things back together. And they started, 100 milligrams of progesterone, and they're like, oh my God, I am sleeping through the night again. My anxiety is quelled. My hot flashes aren't as bad. They bring the estrogen back on and they're like, I don't have the vaginal dryness. I can be intimate with my partner again. I don't have the UTIs anymore. So there is a time and a place for sure. The gap right now that I struggle with as an educator and as a provider is that we are not, I don't think we are I don't want to say that we're not doing a good enough job educating about the root, the base, the foundation that matters the most, which is the lifestyle. Everyone right now is just hearing HRT and weighted vest. And what they're not hearing is optimizing digestion, poop, and elimination, making sure your blood sugar is stable, getting optimal sleep and rest, addressing the things that are the big stressors in your life, managing your circadian rhythm. And so I see it, because being in the integrative space, I know you see this. There's two camps. You've got the functional side of the camp that is like, perimenopause, literally some people right now, perimenopause is made up. This is just like, meno washing. This is, marketing. This is a way to fear monger women and to get them to opt into products and to programs. And if you just lived ancestrally and you started with your circadian rhythm and you just honored your biology, you wouldn't have any of these issues. And then you've got the other side of the camp, which is like, it is irresponsible as a professional to not be giving your women that are 45 and older estrogen, progesterone, and in the US, also the conversation around testosterone is also a huge one. So we have this huge, left or right or wrong, black or white, and then you've got the woman who's sitting in the middle, and she's like, okay, what do I need to do that's not a 12-step friggin' daily journey where now I feel like I have a whole nother job on top of living my life? And that's where I try to come in the middle and be like, okay, regardless of what you're going to choose, because I also think we have to stop judging women for what they choose. The woman who doesn't want to use HRT, she wants to do it through diet and lifestyle and herbs and botanicals and maybe bring in homeopathy or Chinese medicine to support. Amazing. She should get to choose that. This is her body. This is her decision. And the woman who wants to use the HRT and bring in those types of supportive interventions, support her as well. So it's like, there's a lot of us trying to make decisions for people where this is their body and their life. My role, the way I look at it, is to try and provide you as much information as possible so that you, the woman, feel like you're making a decision that is your own.
Yeah. And I think that's where we have to be, right? Like, even for me, it's one of the top questions I ask somebody when they're coming to me for help. Are you looking for just a management strategy?
Yeah,
or are you looking for a recovery strategy? If you're looking for a management strategy and you don't want to change anything about your diet, your lifestyle, your relationships, your sleep, your any of the habits, then you need hormone replacement therapy. That is not me. Go see somebody who prescribes bioidentical hormones. They're going to manage it. Well, how much do I need? They're going to manage it based on what they think is an optimal level. And a lot of clinicians that I've talked to who prescribe, they say, listen, I don't have a set number. I'm just trying to manage symptoms.
Yep.
And that's a management strategy. I'm not here to tell you that's right or wrong. If that's what you want, it's right for you, because where you are in your time, your place, your lifestyle, and that's what you want to do. I think you should have the opportunity to do that. And we shouldn't judge. But we also have to, if the person says, I want a recovery strategy, then we have to say, okay, well, we may need to use some management, but a recovery strategy means we try and get you back as close as possible to you making your own hormones like nature intended, and not just making them, but being able to utilize them appropriately. And if we can't, like what you said, if we can't find the things that are limiting your natural conversion, then recovery to me still means that the hormones we give you work appropriately, don't create negative side effects as a result, and you feel and function awesomely, right? Mm-hmm. So I think recovery, somebody could still be doing some hormone replacement therapy and still be in a recovered state. We see this with thyroid physiology all the time, right? Where people
which is also hormone replacement therapy, right?
It's the same thing. Some people need it because tissue's been atrophied because of a long period of time, right? But if they want a recovery strategy, we can't overwhelm the body with hormone that suppresses the gland's function to begin with, or it will atrophy. If we take, and you can correct me if I'm wrong, but if we take excessive amounts of hormone just to symptom management, and then and the patient wants a recovery process, well, they're not going to be making sex hormones from the tissues the way they should be. You're going to start to downregulate some of the systems, and you're going to be, to some degree, you start to become dependent. We see this a lot in the male world.
Yes. 100%. Right.
Right.
I think
I'd be the last person that would argue that men can't do really great on testosterone therapy. They do. I look at JFK Jr., man, he's doing fantastic with it. But, right, there's it's not as simple as putting it on, because what happens,
You
especially
mean
if they're in a stress
RFK
state,
Jr.? I'm like, I'm Canadian, but I'm pretty sure JFK Jr. is dead.
RFK, yeah,
RFK?
RFK.
Okay.
But like if you're not making androgens to begin with, more than likely, or you're either making them and aromatizing them, they're going estrogen. You take some testosterone, sure, it'll make you feel better. But guess what's going to happen over a period of time? If we, because of the side effect, because the problem's still there, well, then we have to provide another drug to do it. And then what happens when you want to come off? Maybe not so great to be able to do it. But that's a little diversion. But
I want to just say something on that, because it's a diversion. But what you just described perfectly is, medical whack-a-mole. Let's just like bring in this intervention to try to knock down this thing, and then like something pops up somewhere else. So, with women, again, dealing with so many of them who are struggling, they may bring in the hormone replacement therapy, and they're like, now I have this other issue that's showing up and the body doesn't respond to it as well. And then they go, well, HRT is not for me. Well, that maybe isn't the case, but we need a fusion approach. So I find most women benefit best from a fusion approach, which is where we are dialing in the lifestyle piece. We're talking about all the different things that you and I have talked about that really, truly matter, and honestly matter regardless of your age. Like, if 40 and 50-year-old women are listening to this, but they also have 20 and 30-year-old women, those 20 and 30-year-olds, like, the more you can do now to support your overall metabolic and physiological health, you're not going to live your mother's menopause, because you are going to enter this period of time in a healthier state. So, I'm in this place of fusion, which is like, let's get a woman's body functioning as optimally as possible, and then ask ourselves the question, what are the accessory, augmentation pieces that we need to bring in, supplement wise, HRT and otherwise, to help her feel her best?
Yeah. And I think that's the best strategy. We do have this allopathic bad, functional medicine good kind of chasm.
Yeah.
We also have I think it's great we have all these medical physicians coming to functional medicine and saying, hey, I'm frustrated in that model too. I want to come. I think the biggest challenge I see from a functional medicine standpoint is they're bringing an allopathic thought process to functional medicine. Like, well, we're going to give natural hormone replacement versus these synthetics. That's not functional medicine. That's just a different thing. Or, hell, you have high cholesterol, so we're going to give you red rice yeast instead of a statin. That's allopathic philosophy. That's not functional medicine. What functional medicine is trying to find what's creating this kind of dysregulated state or this adaptive state, and reduce or eliminate those things so the body can start to restore. But I think what we need to do is have a bridge and be able to have those communications. Listen, let's make sure that those, for the people that need it or want it, that these acute processes, or there's medications, hormones, drugs to get them to a stable level. But if they still want a recovery process, then they have the opportunity to do this. And that's what you're saying with this is fused or blended version. And I think that's the best model going forward. It shouldn't be just a functional medicine model, because some of these people need hormone replacement therapy. Some of these people need some thyroid hormone. But we can't just give it to them and walk away and say, no, I've optimized the blood level and I'm good to go. Right. Especially if they want recovery.
Yeah.
So let's get into this a little bit.
Okay.
Right. Now we're talking about that was just a warm up. So now we've got a woman who's going through what she feels is a rough perimenopausal process. Okay. And she does want more of a recovery process. So when you're assessing, do you assess slabs in your practice?
Yep. Okay. Yeah, we look at blood, we look at stool, urine, hair, and saliva.
So tell me, when you're, and it's hard to, I'm very like big picture thinking, but if somebody came in, would you just go to their sex hormones and to assess a problem, or where would you start personally with somebody so that the person who's listening knows what they're looking for? If they're like, I want to try and have a recovery strategy, is my physician have me on that path? And what should I be educated to be looking for when I go in and meet with a clinician? Like, how would you start to look at somebody's chemistry, we'll talk about health history, health timeline, all those things are really important. But from a blood perspective, I see people, they go in, they have the symptoms, somebody just runs a blood hormone panel or just a Dutch panel and says, your hormones are low, you need to be on hormones. I think it's way too protocol based, and it's more allopathic than what I'm trying to do for patients and what I think you're doing. So where do you start?
Well, I know you said we're going to talk about it after, but the very first thing that I do and that we do in our team is a timeline health history. I think that's actually the most important thing, is going back to the very beginning. I mean, I'm talking to women and asking if they know anything about what their mother's pregnancy with them was like. That's how far back we go. And then we pull forward to the person they are today, because who we are today is the sum and accumulation of the life that we have lived up to this moment. And then when I'm looking at blood, I would never just order a singular panel. It's a very reductionist view. And so even though someone's coming in with like everything that presents as hormone issues, hormones are chemicals among many other chemicals and messengers in the body. And so I want to look at the full gamut. So I would be running a complete blood lab. And now it's different, where we are in Canada versus the US in terms of what can be ordered and what not. On my website, I actually have a free blood recommendation list with a video that helps walk people through. But I'm looking at the whole thing. I'm looking at a complete, I'm looking at a CBC panel, all the hematology. I'm looking at iron. I'm looking at thyroid, cholesterol, triglycerides, minerals. I'm looking at, yes, the sex hormones, but I'm not hanging my hat on any one result. I'm looking at everything in totality. To me, like when we talk about having a holistic or a functional perspective, you have to be able to pull, it's not a zoom in moment, it's a zoom out moment, and look at those results combined with the individual in front of you and how they are describing what's going on. So again, it's that fusion of the symptomatology plus the serum. And what is it that we are actually seeing? And can we start to connect some dots? I oftentimes find that when I'm taking women through their blood labs, it provides me chemistry, but it oftentimes just provides me more questions, because I'm like, okay, I have other things I want to ask them now if I see certain things that are elevated. And for me, my eyes have been trained to I look for suboptimal. High and low is very obvious. And oftentimes high and low is just like the loudest screamer in the room trying to get your attention to point you to something else that's in a suboptimal range. So, it's very difficult for people to have an experience like that in their physician's office, because they are typically allocated through an insurance model 7 to 10 minutes with a person. There's no freaking way that you are going to be able to get to the bottom of that, which is why in the medical model, you're trying to A plus B equals C, which is symptom plus result equals prescription. Right. And that's where it's different when you're working with a functional practitioner, which is listen, functional medicine is private healthcare. You're paying out of pocket to go and work with somebody who's going to have a very open, out of the box way of looking at what is going on in your health and in your body. I hope that answered that.
Yeah. And I think that's really good, because if I had I don't care necessarily what diagnosis they've gotten, what their overall, I want to fix my hormones. I think my hormones are deficient. Yeah. Okay. It doesn't matter. Sex hormones, thyroid hormones. I assume that if there's some type of health related issue going on, we talked about this on your podcast. We have those two operating states, homeostasis and allostasis. What I want to determine right off the bat is, and I already know that, if they're already showing up with a boatload of symptoms, conditions, and problems, you already know they're in an allostatic state.
Yeah.
But I want them to know that they're in a different operating state, and that the hormone dysregulation is part of that allostatic regulation, their gut physiology, their high thyroid hormone dysregulation. And that's where I say, listen, you've got a chronic inflammatory state going on because there's an excessive load of stress on your physiology. Your hormones are downregulated on purpose. Okay. Your gut physiology is downregulated on purpose. Your thyroid physiology is downregulated on purpose. You don't have a hormone problem. You have a multi-system adaptive disorder going on, meaning you should expect your adrenal gland to be compromised and not be able to then make the hormones you need. You should expect your sympathetic nervous system to be upregulated so you can't sleep at night and you're edgy and anxious and irritable. you should expect your gut physiology to be downregulated. You should expect these things. You're not broken. This is an adaptive response. And so when we go in and somebody just looks at the hormones right away, to me, that is like, I think it's good. If somebody's coming to you, they want to know if their hormones are dysregulated. Yes, you could run that as part to show them, yes, it is dysregulated. But to just jump to, okay, let's just put you on that. That's, to me, more of an allopathic model versus helping that person understand who wants a restorative process. Go, look, number one, we have to do is we need to look at a broader panel to find out what's going on here. And looking at a broader panel that has inflammatory markers on it and saying, okay, we got inflammation markers elevated. And sometimes people just think about CRP or homocysteine, but there's lots of markers on it. Just a good comprehensive general chemistry panel: uric acid, bilirubin, ferritin, fibrinogen, 125 vitamin D being chronically elevated. Like, there's lots of them. And then we get that idea that, okay, this is a person who's got chronic inflammation. They're in allostatic state. The hormones are going to be dysregulated. Now we've got to figure those things out so that the person understands this is a bigger issue. It's not just their hormones. It's all of these systems are downregulated and they're not broken, they're adapting. So I think it's great that what you said, that timeline's important, because that timeline helps them understand the continual load of stressors they've been putting on their physiology for years and decades. And it helps them understand that what you're experiencing today with symptoms that have brought you into an office is the result of maybe management strategies for the last 2, 3, or 4 decades, right? Abnormal cycles, period, or birth control, right? And just keep managing.
Well, and we haven't even talked about that part of it, right? We haven't even talked about, and again, this is the timeline history of all of the things that we have brought into our body that we've been exposed to over the timeline, which is birth control, IUDs. If a woman had PCOS, if there was stress, if there was fertility treatments that were, part of her health history, if there were, big viruses, did she have mono at some point? Does she have Lyme? Is there an autoimmune? Like, there is a huge category of individuality in the person's health history, where when you start to learn more about them, you're like, oh, okay, this is not just as simple as, these declining here, because, you used a word that is one of the best ways, I think, to be able to describe what's happening, which is systemic. This is not simply ovarian decline. This is ovarian decline of estrogen and progesterone that is creating a systemic uncoupling of additional hormones and physiological processes in a woman's body, physically, mentally, and emotionally. And we have hormone receptor sites everywhere in the body, not just within the ovaries. So the biggest disservice we've done to women up until this point is make the ovaries the main star of the show, and saying that it's everything that's encapsulated in here and only about E and P. It's only about estrogen and progesterone. There are so many other factors that are changing in a woman's body. And, the struggle point for so many women is they're only just learning about this in the moment of time when they feel like they are treading water and barely able to get their head above it. And so they're already, at this overwhelming place, and they're like, I'm sorry, what's happening in my body? What started to go on X amount of years ago? You're telling me that when I took this and I did that there was a different option. So there's an anger period. There's a grieving period for so many women. There is a deep frustration. And then what you hope is that there is a lot of grace they give themselves for some decisions that they were making the best one at the time, because we weren't taught. We just weren't taught about our bodies. And then you bring them to a place where it's like, okay, move through all of these emotions, because you don't want to bottle that up. And now let's figure out how we're going to move you forward, because this isn't about how we can support you for the next 30 days. This is the next 30 years, next third of your life that we are talking about. And so this is where, I deeply agree with you in this place of, we don't want to get into a situation, which is happening often right now. We are purely focused on symptom management. Do we want to rescue women of some of these significant symptoms? 100% I'm on board for that. But we also owe it to her to teach her how to support everything behind the scenes that are making those symptoms scream at her and impact her life.
Yeah. So I want to talk about Um, in this second stage, in this transition phase, where's the bulk of estrogen being generated? How's that being generated?
You mean like when you what do you mean second stage? Like when
Okay, so
we
ovaries are kicking
okay.
out, right?
Yes.
Women, their estrogen's going down.
We're banking on the adrenals. We're like, ladies up
That's
top,
what I want you to explain. How
please
are they,
do a really good.
right? Because I had some woman send me a message like, estrogen's made in the fat cells. You don't even know what you're talking about. So
He's talking
where
about
is that?
estrone, which is E1. So we have
Mhm.
many different forms that we produce. There's three that are in concentrated enough that are measurable, which is E1, E2, and E3. So it's estrone, which typically is produced within the adipose tissue. Okay. And this is oftentimes where women will be told that and this is why, visceral and subcutaneous fat increasing as we age, we do need to be mindful of because that can impact E1 estrone. Okay.
But
Yeah.
where's that? How's that? Is that estrone being generated from cholesterol inside the adipose tissue? Or is that estrone being generated from the DHEA and the pregnenolone that's coming from, or the androstenedione that's coming
Mhm.
from the adrenal gland?
Adrenals. Yes.
Ah,
Right.
that's where I want you to get. That's what I want
So
you to.
this is what, and I just want to say, because I don't want to skip over, is that E3 is estriol. And
Mhm.
typically we only see elevated estriol in pregnancy, but I will also tell you, and this is one of the reasons that I do really like the Dutch test for this, is that if you see elevated estriol in a woman where she is not pregnant, none of that is going on, and you see elevated E3 estriol, as well as her metabolic down pathways, elevated 16 hydroxy, elevated 4-OH, suppressive 2 hydroxy, this is an indication that her gut and her liver are really asking you for some extra support. So I just wanted to finish that little loop.
Yeah.
But yes, so the big message for women, and the younger we can start this, the better, is to optimize your adrenal support, which, if you optimize your blood sugar, if you get to sleep appropriately, if you do so many of these lifestyle things you are being taught, you're not over exercising, but you're also not exercising. It's like everything for a woman is really Goldilocks, right? Not too little, not too much. And making sure that your adrenal glands, which are two glands that are about the size of walnuts that sit on top of the kidneys, which, if you look in Chinese medicine, the kidneys are what govern the ovarian constitution, the ovarian health. So our adrenals, they are your body's SWAT team in response to stress. They are where we are producing the majority of our stress hormones. They are what are giving the cues in the body. And the adrenals, they're perceptive glands, meaning the stress you're going through that your brain is picking up on, it can be real stress, but it can also be imagined stress. It can be anticipatory stress. It can be someone else's stress. It can be stress you're witnessing from watching something, listening to something. And your body does not know that that is not yours. It doesn't know. Adrenals, don't go into action down there. Like, this isn't hers or his stuff. This is just what's going on in the world right now. The body picks up on whatever sensory communication is coming through the brain. And now we have a systemic reaction. And this is where so many women's adrenals become depleted over time, because we're living in this chronic state of stress where every day the body thinks that we're being chased down by something and we have to do more and produce more. And our bodies are designed to produce stress hormones. Okay. Like, that is literally the job of the adrenals. This is what they are here for. They are the MVPs. However, when they don't get recovery, when they don't have time to be replenished, when they're nutrient depleted, when they're being, pulled in 15 different ways, there's depletion. Now you have a woman who has low grade adrenal depletion. She doesn't really know this is going on because she just like, this is just my life. Yeah, there's stress. I got kids. We just code it with that, that saying. Now she gets into a state where there are decline and deficiencies and depletions in other areas of her body. And her beautiful adrenal glands that were meant to be the backup singers for the ovaries, when the ovaries are like, our job is done here, we're going off stage, it's now your time to shine. The adrenals are like, I'm sorry, what? That would have been super helpful information for the last 20 years that we've been grinding ourselves into the ground. I do not have the ability to be your backup team. That's in a nutshell what happens.
Yeah, I'm going to add to that a little bit, um, because we hear this conversation about the adrenals fatigue, but I want to. It's not like the adrenals give out. So And
Oh, it's a
I know you don't,
dysregulation upstream.
yeah. So I know you didn't mean that, but because it's talked about so much and,
I know, but I'm saying it in a way where the person who's listening can understand it,
yeah.
right? Like,
So yeah, I'm not disagreeing with you, but I want to tie this back together. So if you have excessive or perceived stress, that's going to trigger some inflammatory mechanisms. And we've talked about that already. That inflammation is going to result in reduced T4 to T3 conversion in
mhm,
circulation.
mhm.
It's going to result in reduced T4 to T3 conversion uh, some tissues. The adrenal gland is going to make hormones based on what the signaling mechanisms are. More stress, more cortisol. What gets downregulated, there's a limited amount of cholesterol that can be made in the adrenal gland into hormones. And so we're heavily reliant on the amount of cholesterol coming out of the bloodstream into the adrenal gland. But the reason I think we see a lot of people start to have what we call adrenal fatigue over time is because the inflammatory mechanism results in reduced T4 to T3 conversion. As we have that happening, we have reduced ability to bring cholesterol from the bloodstream into the adrenal gland. And if you've ever looked at both high and low HDL, I know everybody says high HDL is really good. It's
Yeah.
not really good because it's that HDL that needs to dock to the adrenal gland and release the cholesterol so that the adrenal gland has cholesterol to make hormone. And that HDL receptor, docking receptor, is dependent on T3 inside that tissue. So if you don't have sufficient T3 in the adrenal gland because of the inflammatory process, now you're really starting to restrict the amount of cholesterol that can come into the cell. Cholesterol builds up outside. Now the adrenal gland has a limited ability to make cholesterol inside. And then if you have a limited ability, then you can only make a limited amount of hormones. And now if the demand is cortisol because I'm under stress, your androgen production in that adrenal gland is going to go down, and adrenal production, cortisol production is going to be the mainstay. It's maybe not going to be as high as it needs to be, but that's going to be the mainstay versus those hormones. It becomes really important. And T3 then helps drive that mitochondrial physiology that helps convert cholesterol into pregnenolone. So the stress piece that Jenn was talking about is so important because of the inflammatory process it starts to create, the shift demand from the tissues as to what's more important. Do I make sex hormones so I feel good when I'm having sex, or do I make cortisol to help regulate blood sugar because I'm in danger?
Yeah.
And then at some point, we really exhaust the body's ability, the adrenal gland's ability to kind of keep that process potentially going. And we'll even see the blood levels start to drop on a blood test to not, well, typically you don't see it lab low, but I see it a lot of times when they're really getting to a bad state. They're starting to see that the blood cholesterol is at the lower end of the reference range, along with the test, those markers as well. And what happens in the meantime? Well, the adrenal glands have other tissue or other hormones there that they can generate, compensate for energy production, for glucose regulation. And unfortunately, those are your catecholamines that then have a more stress, anxiety inducing effect on the physiology. And they'll work, but they're meant to be short term, not chronic.
Exactly. And this is, there's so many things in what you just said that we could like open up other doors to, because everything you just described is, when women are going and getting their blood work done, most women in that time of shifting to menopause, they will start to see levels in their cholesterol markers starting to look unfavorable. And then oftentimes in an allopathic space, what's going to be recommended is a statin. So we bring something in that's going to downregulate the glands and the body's ability to do all the things you just talked about. So this again is the whack-a-mole. Oh, shoot, we see this going up. Let's hit it down, instead of asking the bigger question and understanding the physiology that you just described about what's driving that result to do the thing that it is doing. And so, it's like, I would love if there was a way to be able to just like simplify so that everybody could understand what's going on. Because when you start to, tap into this kind of information, your brain is just like, oh my gosh. And I think what you said at the end there is the most important piece, is that instead of making the hormones or the cholesterol the main thing, coming back to what is fatiguing and stressing your system as a whole. So it's not about necessarily adrenal fatigue, but what is stressing and fatiguing your system as a whole, where it is now, you know, it's not that it's not doing what it's meant to. We talked about this when you were on my show. The body has incredible systems and checks. And what you just described is how the body prioritizes. If there's such a level of stress going on, your body's like, this is a priority, this is not. This is a priority, this is not. And, you know, internally it may be working to support our systems, but externally it does not feel good in the body who has that going on behind the scenes.
Yeah. So when we have that low, if the adrenals are taxed, we're not making androgens at the adrenal gland, then you are going to have potentially low estrogen production, because those androgens go out to the peripheral tissues and get converted into E1, E2, and they're going to be low because you don't have the androgens. Why don't I have the androgens? Because the cholesterol's in the blood. It's not in the tissue. Why is the cholesterol stuck in the blood? Because I have an inflammation that's decreasing T4 to T. So it is this complex thing. So I want to hit two more things before we run out of time. One is this discussion that we hear that taking estrogen at this phase of life is unhealthy because it can create problems and cancers and all those things. So we'll have that discussion. And then we're going to talk about what are the key things that somebody can do to start fixing their hormone physiology and their health overall from a more natural state. But there's this, I've read these, I hear things that people say, well, estrogen, we shouldn't be taking it in this second phase of life here because it can bind to receptors and cause cancers and all those things. So estrogen's bad. And I have people asking me these questions as well. But I'm like, listen, you've had high estrogen for the first half of your whole life. If estrogen was this terrible thing, do you think you would have been having massive amounts of it? Okay, well then why are people saying that taking estrogen after menopause is bad? Well, I don't think in general estrogen is bad. Do we need the issue really probably comes down to when we put estrogen in, how much are we putting in, and can we manage it appropriately? Same thing with testosterone in men, right? Or women, right?
Yeah.
If we put it in, we sometimes make the assumption that if we just put it in, it's going to do what we wanted to do and the body's going to clear it out the way we want it to. But the problem is, from my standpoint, is more about what happens to that hormone in the system and how we regulate it, and versus then just
how we metabolize it and how we
right.
excrete it.
Those
like,
are the keys.
What is the body's, recycling versus garbage takeout system that's going on behind the scenes. And unless people are testing for this and spending the time, you can't know that just simply by sitting across from someone. So this is, again, the piece of understanding someone's chemistry is important. But, I definitely agree in, so I'll give you an example for myself. So I'm 45. I don't have a ton of symptoms of perimenopause, but I did start to notice some things, about a year and a half ago, 2 years ago, where it was shifting in my sleep, my mood a little bit. I was just noticing things. My cycle got a bit shorter. I was noticing things for me where, I've tracked since I was 17 years old, my cycle. I am very in tune with my body. I do regular, blood workups and stool and you name it, all the things. And I started to notice some changes happening. I was like, And I, had been taking Vitex and using different herbs and different things like that to support. And it was helpful in the beginning and then kind of just wasn't. And so I had a conversation with my functional medicine practitioner, and she's like, are you open to trying some progesterone? And I was like, I am, but I actually want to start at the lower end. I'm a big one of low and slow, titrate up. Let's just see how the body responds. I don't like to hit us over the head with a hammer. So I started with 60 milligrams. Oral, Permitrim. And I was like, okay, and noticing some changes in my sleep, those kind of things. And now I sit in around the 100 milligram mark, and that feels good for me. I don't have a single symptom that indicates I have low estrogen right now. And when I look at both my blood work and I look at my Dutch, I'm sitting kind of in a suboptimal window, but not low. And so it's looking at the chemistry, but then also what are the ways in which I'm describing myself? Now, some practitioners would say, you got to get on the estrogen now, Jen. You're 45. You want to get in front of it in order to reduce any potential harm. For me, I know if and I had this conversation with my provider and I said, what do you think about me bringing estrogen in, prophylactically? And she was like, I think you'd be really pissed off at me because if I give your body right now, who's not symptomatic, estrogen, you're probably going to end up with a lot of breast tenderness, mood swings, gain a little bit of weight, and probably not feel great. And for me, my decision is like, I decided not to start the estrogen right now because I was like, how am I actually feeling? How does my body feel? And I understand the neuroprotective benefits, the bone, the breast, the heart, all of that. It's looking back at the lifestyle. What are all the other pieces and things I'm doing that are supporting that, from like a nutrient intake and minerals and how I live my life? Now, when we, talk about this in terms of breast cancer, or we talk about cancers as a whole, if the reality was that an increase in women taking estrogen post-menopause was a primary indicator of breast cancer for women worldwide, why is it that when women go into menopause and are postmenopausal and arguably have the least amount of estrogen they've ever had in their life, their increase of breast cancer goes up?
Mm-hmm.
So, again, it's just we have 22 years of unlearning and new data and information and research that has to be done since the WHI study. And so, I do not claim to know everything there is to know about hormone replacement therapy when it comes to cancer or to certain genetic, predispositions and that. And I'm still learning as time goes on. I do think that a really incredible resource is the book Estrogen Matters by Dr. Avram Blooming. I think that they have, an interesting way of being able to look subjectively at what it is that's going on. But I don't sit in a camp of either or. I'm not like every single woman needs to have it, or no, nobody needs to have it. We were just designed to go through this. Because I also think on the other side of the coin, women are living longer than they ever have before. We don't actually have literature, data, and research outside of the SWAN study that is showing, region to region. Like if we were to have this conversation about women in parts of Asia or women in Japan and their experience going through this, it is night and day to the North American woman who's living in, the kind of climate we are, how our body's going through it. There are certain villages and tribes around the world, they don't even have a word for menopause because women don't move through it in the same way that we do in inflammatory North America.
Yeah. And that goes back to our original topic, right?
Yeah.
It's not an
We just all
abnormal
need
process.
to move.
Right. But we can do a better job where we are. So let's talk about that. We've got about 15 or 20 minutes left.
Yeah.
And I think I want to make sure people have some take home stuff, not just, should I be on hormones? Should I not? That's a different, we talked on why there's changes. We talked about why the change is not the problem. It's everything that occurs. And then you go through the change and you're not able to manage or adapt to that change as well as you could or should. But what should somebody start to do today?
Yes.
To improve their hormone physiology and I would say to reduce their excessive stress load, to reduce their inflammation and improve their overall physiology. But if they're thinking, I want to improve my hormones, it's all the same, but what would your recommendations be?
So we have agreed that stress is probably the biggest elephant in the room that is pulling the largest strings on our system. When you try and tell someone to work on their stress, it's probably the hardest thing for them to conceptualize how to do. And so I'm going to give you a lot of tips for your listeners that if they do all of these, by nature, it's going to decrease the amount of stress that they have. So the first thing for me when I'm working with women is optimizing their digestion and their gut function. Can we start to look at the quality of what you're putting in your body in terms of your food and your water so that you're actually getting in, meals that are comprised of healthy amounts of protein, carbohydrates, fats, and fiber? Can we get you into a rhythm where you are eating a healthy breakfast, a healthy lunch? I find for most women, they typically need a little something to support blood sugar around 3 to 4 in the afternoon, and then a healthy dinner. Can we start there? And in terms of healthy digestion, one of my first goals would be not just to stabilize the blood sugar so you feel satiated and energy is even and you don't have the cravings and you're sleeping better. Those are the primary markers for me. I know if a woman is starting to tell me, I don't have the cravings, I'm not chasing down the chocolate chips in the house, I have good energy, I'm not sleepy after a meal, and I'm actually sleeping better, I'm like, we are winning. The next stage of this is looking at if we have things like gas and bloating and reflux and indigestion, and we have constipation and diarrhea, we have to get your eliminatory pathways well supported. Before we go and do something like, I'm always supporting women's livers, but if we're going to go and try and unbind some level of toxicity upstream and the back end is plugged up, we got a problem now, because if you aren't properly eliminating, we're going to recirculate and retox the system. And this is when people get what they think are like a Herxheimer response, like a detox symptom. You shouldn't be stuck in that for a long period of time. So we get you pooping, really important, really healthy, good quality poops on a daily basis. Supporting the liver, as I said, important. So eating bitters, getting in, radicchio and arugula and dandelion greens. Those bitters help to produce beautiful stomach acid, and they support the liver through that filtering and that detoxification. Adding in things into your water, like as I'm talking to you now, like I have my methylated Bs and I've got my amino acids. Using filtered water, drinking out of glass or stainless steel, not plastic, that's a free thing that we can choose to do, is like just stop drinking out of the plastic and drink out of the glass is a low-hanging fruit for a lot of people. And then there could be certain nutrients and other things you're bringing in, like you may need digestive enzymes, or at the very least digestive bitters. You may need some, a liver tincture. Drink teas that have it, right? Teas are fairly inexpensive. You can get a good quality dandelion tea or milk thistle, nettle, wonderful. And so that would be in terms of like from the nutrition and digestion side of things and liver, that's where we would start. Begin to move your body. Your lymphatic system matters throughout your whole life, but when you get into perimenopause and menopause, just like I was talking about the elimination pathways, our lymph system, this is your highway of waste and byproduct. And so if we live a sedentary lifestyle, we need to get things moving. We need to have the lymph really well supported and be draining properly. And, again, talking about things that are low hanging, everybody owns a pair of shoes, hopefully, and can go for a walk. And that doesn't cost you anything. Walking 10 minutes after a meal, wonderful for glucose management and to help regulate your insulin in your body. Incredible for your mind. I think it's medicine, to be honest. And, just a very easy way to also be working on your body composition. Outside of the walking, women always ask, what's the best type of exercise to, battle gaining weight as I'm getting older? And my first response would be, what do you love to do? Let's not worry about the specificity. What do you love to do? And can you start to do that a few days a week? That could be like putting on your favorite music and just dancing your ass off for 3 songs, right? And just like getting your movement in that way. Strength training is going to be important when you get to a point where you feel like you have the capacity energetically to do that. And so if women can be lifting weights, 3 to 4 times a week would be fantastic. And focusing on some of the movement compounds that are going to give you the most bang for your buck, right? Squatting, I love for so many reasons, because it's going to help, with your ankle flexion, your hip mobility, even just the act of having a barbell on your back, the range of motion and mobility and through your shoulders. Deadlifts and shoulder presses and rows and those kind of things are going to be so amazing. So for the women that we work with, I'm always helping to get them to understand, like, let's focus on push and pull. Let's focus on those types of movement patterns first. The more muscle you have on your body, you are supporting everything we just talked about. Especially when it comes to that glucose management, especially when it comes to, having a strong, stable body moving forward. And then we've got to talk about, outside of the strength training and walking, be careful you're not doing too much cardio. For women, we like to swing from one side to the other. And a lot of women are doing too much, like all those HIIT classes and everything you used to do 5 days a week. You can still do HIIT when you're in your 40s and 50s and beyond, but you probably need it once or twice a week now, right? As we get older, more is not better as we age. Be really efficient in what you are doing. So, when we're talking about HIIT training or like sprint interval training, we're talking like you could do as little as 10 seconds of hard work, recover for 30 to 45 seconds, and repeat that 10 times through. And then sleep is the queen. Like you need sleep now more than ever. You are an infant at this stage of life that is going through so many changes. And so for women, we know that the best, most restorative sleep from an adrenal perspective and from a full system reset is from 10 p.m. until 2 a.m. If we have women that are chronically waking between 2 and 4, and it's like clockwork, they don't even have to look at the clock. They know what time it is. Stabilizing that blood sugar, making sure that, cortisol management is happening in an appropriate way. It's going to change her life. So getting to bed as early as you can. I like ladies, if you can be lights out no later than 10 o'clock, and, sleeping through, trying to wake naturally in the morning and getting exposure to light is always going to be wonderful. I'll say one of the biggest changes my husband and I made as we got into our 40s, and it's easier now because our kids are older, they don't need us in the same way at night. We are lights out by 9:30, and we've never, like sleep is just so good. It's like kids. The earlier you put them to bed, the better they sleep. We are the same. So those would be the things that I would start to be focusing on now. Gut health and your nutrition, get your body moving, stabilize your blood sugar, optimize sleep. And then I think the one that we all forget about is like, find some joy in your life. Like there has to be some levity. There's got to be, fun and lightness. And, sometimes things can feel really heavy and arduous. So how can you be in an environment or in a space where you can actually find some gratitude and find some joy and let there be fun?
Yeah, I think those are all great suggestions. And I think that really the important thing is that too often we're looking for the big sexy thing because that's on social media and, Instagram and, I'm going to take this supplement, it's going to fix everything. No, it's not. That's good marketing. The thing that's going to push the needle the most is not the supplement. Supplements are a tool, not the tool. But what's going to push the needle the most is the small, continual, incremental changes that you make to raise your level of fitness, as I call them, in your health or fitness factors. And Jen just went through a bunch of these: sleep fitness, dietary fitness, emotional fitness, how you perceive the world and what comes at you, right? Everybody thinks, all these things are going on, my work, and everybody's, yeah, that's true. But how are you perceiving it? That's the difference in how life affects you. Your environmental stressors, how can we clean that up and be pure? Like Jen she was talking about that earlier, all the toxins and all these things. There's so many small incremental ways that you can improve, make changes, not dramatically. If you want to do it dramatically, that's great. But I think that's more stressful on people. Just slowly, incrementally, you look at these different aspects of your life and say, how can I improve my personal care fitness? And you reduce some of the toxicity, slow and steady. As the toothpaste goes away, as the deodorant goes away, you change it. That make a difference? Absolutely, it can make a difference. How can I incrementally shift from a high processed food diet to a whole food based diet?
Yeah.
Well, what about carnivore? What about keto? Don't pay attention to those things right now. Just focus on switching to a more whole food based meal. And I would say too, is that as you make these incremental changes, how can I improve my sleep? How can I improve my respiration? How can I improve my financial stress, right? How can I improve my relationship, right? And so that that's better, right? With my kids, my spouse, my family, like small incremental changes. It was small incremental changes that cumulatively created the problem. Occasionally we have these major life changing events that really trigger a process. Going through a pregnancy, right? That can be a massive change in our physiology. The death of a family member, right? Something like that can be a biggie. But for the most part, it's these small incremental changes. And I would say one more thing: stop trying to perfect one category and spend so much time. I have to be perfect with my diet. Why are you not doing any physical activity? I'm so focused on my nutrition. Yeah. Okay, look, we don't want perfection. I don't want perfection. What I want is 80% good habits and 15 to 20% bad behavior. That's what keeps us happy, right? I can't ever have alcohol. Okay, if you don't want to have alcohol, don't have alcohol. If you drink alcohol all the time, yes, you're going to be toxic. You're going to have more body fat. Those are going to be problems. But if you have occasional alcohol and that brings you joy when you're sitting around with your friends and your family and you're laughing and you're having a great time, and you do it with some level of moderation and infrequently, it can be a really positive thing. So it's not about perfection, number one, because so many people I see are so stressed out trying to be perfect and they ignore all these other factors. If we had to raise a home, we wouldn't jack up one corner if 4 feet we needed to get it to, because that would destroy the home. What we do is we incrementally go from corner to corner and jack it up like an inch, and then go to the next one and jack it up an inch. And that's what you need to do with these lifestyle factors that I talk about, and I'm sure Jenn talks about too, is okay, let me do a little bit of work. Let me start cleaning up my diet. Now I'm getting more consistent with that. Okay. And I'm going to make sure I get my sleep pattern in. Good. And now I'm going to start working on this next piece. And then what can I do to keep improving these things? That's going to have the biggest impact. Not the meds, not the supplements, not the latest, greatest thing that some Instagram person is trying to promote on social media. It's the low hanging fruit. It's not sexy, but ultimately, if you want to recover your health and quality of life, you got to put most of your time and attention on improving your level of health and fitness in a whole bunch of different categories of your life: diet, sleep, nutrition, relationships, emotional health and fitness, cognitive health and fitness. And for goodness sakes, find time to unplug. Right? We talked about find time for joy, but it's real. I think people are so plugged in all the time: TV, social media, Netflix, whatever, always on the thing. And I think we do this because it diverts from dealing with what's really going on. Right? Many times, like, I don't deal with, I'm going to go do this. I'm going to go watch a movie. I don't feel like dealing with
That's
this. I'm
how
going
we
to go do
numb
this.
out. We've just been
Yeah.
taught, and it's just socially acceptable to just numb out. I mean, even I watch when people are with other people and everyone's on their phone, and I'm just like, it's so, I mean, in our generation, we're the ones who are witnessing this. Like, I watch my kids who are teenagers sometimes, and I'm like, you're literally all sitting in a room together. Are you like texting each other? What are you actually doing? But we numb out, and everything you just said there, it's like, I always say to people, it comes back to the boring basics repeated again and again. And anybody that you interview who is healthy or who is successful in their life, and you ask them, what are your secrets, and then they tell it is they live a boring, basic routine and
Structured.
rituals.
Yeah.
Yes. And
Yeah.
just done again and again. And so I love your analogy of the house too. And I'll finish with this one because I use it often, is that, we use things like biohacking or, supplements and that to come in and try to like fix the cracks in the foundation. And if you have cracks in the foundation of your home, you can go in and you can like, mortar them up. You can put a patch over them. You can decorate, have the most beautiful home. But at the end of the day, the cracks are going to continue to get worse and worse. And this is our health. If we keep trying to work things from, like that upper place, if I got to buy more and have all this stuff, no, you don't. Start to work on the foundation, which the foundation is your gut health and your nervous system health. And like everything else from there, will start to calm down. And now you can build a solid home that your body is going to live in for the rest of your life. Because I think we forget this. Because we're in such a time of consumerism, it's like we think, oh, it's like if this shirt, I don't like it anymore, I just get to take it off and go in my closet and get another one. You do not have other bodies hanging in the closet that you get to just unzip this one and go step into another version of yourself. So, it is our bodies are a gift. And my greatest wish for women is that they start to actually believe that their body is a gift, as opposed to their body is broken and that there is something wrong with them.
Yeah. And I think that's a great way to end, because I say the same thing. And I fully believe that. And that's why we have to keep that conversation around you're not broken, your body's adapting, you're fixable. We just got to make some small, continual, incremental changes, and you can get your health and quality of life back. So, Jenn, let's wrap up with, if people want to know more about you, your books, your programs, where do they go?
Best place is Instagram, which is Jenn with 2 N's Pike. And then my podcast, The Simplicity Sessions. And other than that, jenpike.com.
Okay, awesome. Well, Jenn, I appreciate having you on the podcast. We could do another session like easily and keep going. So it was really good. I appreciate coming on, and I wish you the best. Continue to do what I think is the most important thing for our civilization, is to continue to promote the idea of health and well-being from improving diet and lifestyle and our habits and behaviors. If we do those things, we can improve the health of the individual. We can improve the health of our communities. We can improve the health of our countries in the world, and we'll have less health crises, less pandemics, less of this stuff going on. And I think we'd have a happier and not just healthier and happier, but probably more financially successful communities. So thanks so much for coming on the podcast.
You're welcome. Thanks so much for having me.